In this edition of Generations, it's October and time for the annual Medicare Open enrollment once more. We talk with Laura Cruz from the Senior Resources Agency on Aging about important changes to Medicare coming in 2021. And Judy Jencks from seniorcenterct.org joins us to talk about Medicare and why you need to review what you have. Hello, I'm Brian Scott Smith and welcome to Generations, a podcast for people of your generation. If you're 65 this year, you will be eligible for Medicare for the first time, and if you're already a Medicare recipient, then it's just as important a time for you as well. Every year there are changes to Medicare, and 2021 is no different, which is why we spoke recently to Laura Cruz, Director of Benefits Access at the Norwich-based Senior Resources Agency on Aging, to get some of the Medicare highlights for next year. So Laura, ever so many thanks and welcome to the podcast.
Nice to be here.
So it's that time again, if you're a Medicare or Medicaid recipient, open enrollment in October. We're going to talk about the highlights because every year there are changes to Medicare. So let's kick off. Part D is the drug coverage part, isn't it?
That is correct.
Talk us through some of the changes there. One in particular, which I know has been a big sort of like news story this year, is the cost of insulin. And insulin is actually on there, which is good news.
Absolutely. In prior years, the cost of insulin has absolutely skyrocketed, at some points even making it unaffordable for our Medicare beneficiaries. So just recently signed into law, and the Centers for Medicare and Medicaid Services have been working on this, have come up with an innovative model called the Part D Senior Savings Model. This is everything pertaining to basically insulin. So it's an insulin savings program. Just to understand, not all prescription drug plans will be participating with this, and not all Medicare Advantage plans with drug coverage will be participating with this. So if you are an insulin taker, you definitely want to check out your plan and determine if they're going to be participating in this model or not. So you want to utilize the open enrollment period to screen your medications and determine which plan may be right for you. But the great thing about this new model is it's to offer just various and multiple types of insulin at a maximum copay of $35 for a 30-day fill, which is a huge cost savings compared to some of the other prices that we have seen throughout these last several years.
I was going to say, because we've seen that shoot up to literally hundreds of dollars for insulin, which is used by so many people and has been around for so long. It's almost criminal that it was allowed to even get up to that sort of level.
Exactly.
Also, let's talk about end-stage renal disease. That's something as well that's added into 2021. Talk us through that.
Absolutely. So in Medicare's terminology is individuals who gain Medicare coverage due to end-stage renal disease, which is basically permanent kidney failure. All you could do was enroll into original Medicare. Hopefully you were able to pick up a supplemental plan, also known as a Medigap plan, and you needed a prescription drug plan. Well, with the original Medicare model, there's so many things that are missing from that are very important to individuals on Medicare. And those are things like dental, vision, and hearing. And prior to that, individuals with end-stage renal disease could not enroll into what's called a Medicare Advantage plan. And with the Medicare Advantage plans, they offer more benefits than what original Medicare does, like I just said, like dental, vision, and hearing. They even offer some fitness benefits, like some individuals might know Silver Sneakers is one of the big ones. And that basically allows a gym membership, and you can go to the gym and, stay healthy. So now, if you have been diagnosed with end-stage renal disease, beginning January 2021, you can enroll in specific Medicare Advantage plans where end-stage renal disease is their key factor. And then you can get the benefits of all those other added supplemental benefits that original Medicare does not offer. So again, the open enrollment period is when you want to make those decisions.
Now, something new as well for 2021 is acupuncture. So they're looking at a non-traditional sort of treatment. Talk to us about that, because that's quite interesting.
Absolutely. This is wonderful for individuals who suffer from constant chronic low back pain. Medicare in the past, their chiropractic coverage was very limited. But now, as of 2021, original Medicare is adding on the benefit or services, I should say, to cover acupuncture. Now, there's certain ways that a person would need to utilize this. So it's just not everybody's going to qualify for acupuncture for any diagnosis. There's specific information on how you can access the acupuncture benefit. So in 2021, Medicare will cover up to 12 visits in a 90-day period for individuals who've been diagnosed with chronic low back pain. And this is the only diagnosis that an individual will be able to utilize the acupuncture benefit. Your low back pain has to have lasted at least 12 weeks or longer and have no known cause, meaning it's not related to, say, metastasized cancer or infectious diseases, and it's not associated with, say, previous surgery or if you're pregnant. So there has to have no known cause. Unfortunately, though, the bad part is if your provider who's providing the acupuncture services, if this provider decides that this chronic low back pain isn't improving or it's getting worse, Medicare then will cease to cover any more acupuncture treatments. So hopefully it helps the Medicare beneficiary with their chronic low back pain. Otherwise, your provider is going to have to go back to the drawing board to try to figure out what else may work for you.
Another big thing, of course, in the world of COVID that we all live in, telehealth has become a very big thing now for the medical world and obviously for our doctors, etc. Talk us through, the telehealth aspect.
Yeah, and especially like you said, in the world of this pandemic, it's so risky for individuals with underlying conditions to leave their home to seek services and items of that nature. So many health insurance plans, not just Medicare, but many health insurance plans are now offering telehealth appointments, which is great because it's just a way for you to actually see your doctor on the screen, have an interactive conversation. So in order to access a telehealth benefit and have Medicare pay for it, is basically it's a two-way communication street here. So you have to be able to look and see your provider, as well as your provider and yourself need to be able to speak back and forth. So using like a Zoom platform, because you're dealing with a lot of private health insurance information or personal identifiable information, I should say, it needs to be a secure platform. If you are interested in telehealth, you do want to reach out to your doctor because, let's face it, this is the least riskiest way of being able to get health services that you need that may not require you to actually have a visit, an in-person visit with your provider. It's covered the same way as original Medicare typically covers any in-office appointments, meaning it's covered at 80%. If you have a supplemental plan, which hopefully you do, then the 20% would be picked up by your supplemental plan. So if in doubt, you're not feeling well, but you need to be seen, reach out to your healthcare providers and inquire about telehealth services. And so hopefully you can still get the care and services that you need.
And I suppose another thing to add there as well, Laura, is if you are already feeling a little bit under the weather and maybe don't have the mobility to get out to see your doctor, I mean, a lot of doctors' offices are, of course, open now despite the continuing COVID-19 situation. As you say, they're going to be able to react more quickly to the situation for you and maybe possibly even provide some home assistance or home care.
Absolutely.
It is open enrollment period. So let's talk through that because I don't think there's any changes, but I leave you as the expert to fill us in on the situation. So what is the open enrollment period again for this year?
One of the things that I'm asked often these last couple months is Medicare going to change the open enrollment period just because, businesses maybe still be shut down to in-person appointments? The answer is no. Medicare is still going to move forward with what's called the Medicare open enrollment period, which begins October 15th and ends December 7th. The Medicare open enrollment period is for anyone who's actively enrolled in Medicare Parts A and or B. And you have already selected, you have a Medicare prescription drug plan, or you're enrolled in a Medicare Advantage plan with drug coverage. Perhaps you never selected a prescription drug plan before because you never took drugs, but now you might need medication coverage. This is your time to decide If the coverage you have now, the plans you have now, so let's just say you're on original Medicare with a Medigap plan and a Part D plan, you want to look at all your options. Is your Medigap plan good for you? Do you want to change it? Do you want to have a lower premium? Do you want to have a higher premium with more coverage? What about your Part D plan, your drug plan? Unfortunately, a lot of times is every year plans change as far as premiums, deductibles, copays, what you may end up paying. They may add drugs to the formulary, or worst case, they remove drugs from the formulary. And it's the same thing with the Medicare Advantage plans. This is your time to check with all your healthcare providers. Are they still going to participate with the plan that you're in next year so you can still utilize them for your healthcare coverage? And the same thing with the prescription drug plan that's built into it. Are your drugs still going to be covered next year? Did they remove some of your drugs? Can you afford the premium that is attached to the Medicare Advantage plan? So what I'd like for individuals to be on the lookout for is every year, usually towards the end of September and the beginning of October, and I know they're going out because I've already spoke to some individuals who have it, is your plan needs to send you this notice, and it's called the annual notice of change. So be on the lookout from it from your current plan. This is an important document to read and understand because this document explains the changes your current prescription drug plan or your Medicare Advantage plan with drug coverage has made. And things that are included in this are premium increases or perhaps maybe even decreases. That would be nice. There could be changes in your copays, what you might pay for certain tiered medications like tier 1 or tier 2, moving on and so forth. Your coinsurance may change. Coinsurance is a percentage of the cost of the medication that you might have to pay. And of course, grand old deductibles. There's some plans have a calendar year deductible for prescription drugs and some don't. There may be changes in your service area, meaning that plan may no longer be offered in the county that you live in, as well as changes in your drug formulary. So those are important things that you want to know. So therefore, come January 1st, you're not in a crisis mode and then realize your plan's not working from you, because there's very limited cases in which a person could change outside of the Medicare open enrollment period.
As we always say with Medicare, there's a lot there, a lot to think about. And of course, one always needs some good expert advice other than speaking to an organization like Senior Resources Agency on Aging, which of course is who you work for. There's another program which I know that you can give us some details about called Choices.
So Choices is the state of Connecticut's state health insurance assistance program. This program is available in every state within the United States and the U.S. territories. And this is like a bunch of network of community-based organizations, as well as, say, the area agencies on aging, provide free, unbiased information about all of the Medicare related information. And this also includes help with enrolling into a new prescription drug plan, or if you're choosing to enroll into a new Medicare Advantage plan. And we do our work through the Medicare.gov Plan Finder tool. So the way it works in the state of Connecticut is all the area agencies on aging, there's 5 of them in Connecticut. We are all part of what's called this Choices program, and we are all fully trained, we're certified. We provide trainings to other people who want to learn how to become a Medicare counselor. And that's what we do on a daily basis. We just provide free, unbiased information to all Medicare beneficiaries who want it. And because again, we're in the world of COVID, the open enrollment period, it's going to look a little bit different for all of our area agencies on aging. But if you are interested in speaking one-on-one, perhaps via phone or maybe even a Zoom appointment, you could definitely contact the Choices program. And you can do that by calling our statewide number, which is 1-800-994 9422. Or if you live in New London, Middlesex, Tolland, or Windham counties, you can contact Senior Resources Agency on Aging directly as well. There's myself, my name is Laura, which you know that, and I have my cohorts there, Sally Huck and Lori Napolitano, who are well versed in the Medicare realm and very happy to provide you information and enrollment assistance into the plans. And you can reach us at 860-887-3561.
Laura, it's always great talking to you. You are, of course, the Director of Benefits Access for Senior Resources Agency on Aging based in Norwich. We are lucky to have you, and thank you for walking us through some of the highlights for Medicare 2021 and, of course, the all-important open enrollment period. And thanks for joining us on the podcast.
Oh, thank you.
And apart from contacting Laura and her team for free advice, you can also visit the Medicare website at medicare.gov for all the latest about Medicare, including explanatory videos and details about the open enrollment period. And joining us as always is Judy Jencks from seniorcenterct.org. Judy, socially distant again, how are you?
I am wonderful and sick of this, but it is what it is, and we just need to move forward.
We do indeed. So what's your ode this month for us?
I'm going to talk about the yearly healthcare coverage checkup. Every year, usually in the fall, it's time for all of us to do our annual check to see if our insurance will be meeting our needs for the next year. We all need to look at our Medicare, what we have for a supplemental, and what our prescription policy covers. So for Medicare, do you have Part A and Part B? A covers the hospital and B covers 80% of all of the other approved services. A is covered when you apply for Social Security. And if you select to have Part B, it's taken monthly out of your Social Security. And to cover the other 20% of Part B, you can choose a supplemental insurance, and there are a lot of plans to pick from, or you can choose to self-pay that 20%. If you choose to have a supplemental plan, then you should review that the plan that you have is the best one for you to have the next year. Then pick the company that offers your plan at the lowest monthly rate. All plans at each level offer exactly the same coverage. They just charge different fees. For example, Plan G might be offered by 14 insurance companies. The price can range from, say, $200 a month up to, say, $500 a month. The coverage is identical in all of the Plan Gs. So buy the $200 a month plan and you'll save a lot of money. It's very similar when you check for your prescription plan, which is Part D. Buy the best deal for you. Deciding is a little more complicated as you want to check that the medicine you are taking is covered by the plan you buy. Visit medicare.gov and select Find Health and Drug Plans and plan on spending a half hour or more checking what you have and which plan is best for you next year. Be sure you're comparing drug coverage, deductibles, and copays. Then there are Medicare Advantage plans. These are very similar to an HMO or a PPO, where you pick providers from the in-network list. Generally, there's no monthly premiums for health coverage. You might need to change doctors, but maybe not. And these savings sound very attractive, but be sure you're prepared, as you will have copays for visits to the doctor, fees if you go for PT and for other services. These out-of-pocket costs can be as high as up to $5,000 a year to $6,700 for in-network before your plan kicks in again. And remember, this is per person. So if you are picking a Medicare Advantage plan, you might want to set up a separate bank account with $5,000 plus in it. So if you or your spouse falls ill, you have the money to pay those out-of-pocket costs. No one needs to be worrying about money when dealing with an illness or an accident. With all of this said, set aside at least an afternoon to review your coverage, your insurance plans, changes in your health, and your prescriptions for the last year. Then look into what coverage you want for next year. If this is overwhelming, reach out and ask an expert for help. You can visit seniorcenterct.org and call your senior center or senior resources, All of those phone numbers are there for you. And the sooner you do this, the better. Open enrollment starts October 15th and ends December 7th. So if you do nothing, your coverage will stay the same as what you have now. So start today looking at your coverage and deciding what you need. These professionals are waiting for your call, and best yet, their help is free.
Absolutely. And of course, we spoke earlier to Laura Cruz on this show, who's the Director of Benefits Access at the Senior Resources Agency on Aging here in Eastern Connecticut, and got a bit of a lowdown on the highlights of Medicare for 2021, because of course, as always, every year there are changes to it. And I know that Laura's organization, Senior Resources, are great for what you've just mentioned as well. The other thing I wanted to add as well, Judy, and people don't always realize this, is you can actually go and visit your local pharmacy as well, and pharmacists will actually talk to you and talk you through. Obviously, they're not insurance advisors, but they can certainly give you advice, especially if, like you said, with Part D with the drug coverage, because we all know that drug prices are so horrendously expensive. So anything that you can do to make sure that you're getting the best value. So it's always good to obviously go in and speak to your friendly pharmacist as well.
Yes, it is. And pharmacists really do offer a lot of help in a lot of different ways. Just like the help with deciding on all of these insurance plans, senior centers and senior resources, they provide the assistance for free. But, a lot of insurance companies will help you with this as well. A lot of times we can walk into certain stores and there will be representatives from insurance companies there to help. The important thing is to make sure you don't miss the deadline and that you get what is best for you each year.
Yeah, absolutely. I mean, I think that's something that, whether it's health insurance, also like insurance for the home or for the car, I mean, I don't think we do that enough as a society, is remember to go and shop around, because there are deals to be had. And the other thing, of course, is if you're new to Medicare, I mean, if you turn 65 this year, so you are eligible for Medicare, I mean, it is quite a minefield, and you do need to really talk to somebody about it, as you say, to make sure you're getting the best plan for you.
Yes, when we first retire, all of this can be very overwhelming because we're used to working for a company. Generally, our insurance comes through the company, and there's somebody there to just tell us what's covered, what's not covered. And then we retire, and we're supposed to know this stuff. And we feel very ill-equipped because we don't know anything about it in general.
So as always, great advice, and certainly for this time of year, we try to cover this every year, and I hope that we do justice to it, because it is such a huge topic. But at the end of the day, the advice from you and everybody is, speak to somebody, understand what is out there, what your options are, and just make sure that you are getting the best deal possible. Because once you decide on, a particular policy, you're stuck with it for a year, aren't you? If it's not right for you, then hey, you're going to have to wait until next enrollment period.
Yes, and that's a year away. And the important thing to always keep in mind is there are changes every year. You have changes in what you might need for health coverage, but that coverage changes as well. So we really need to be on top of what is being covered, what is not covered.
And another important thing, and I'm just going to quickly go back to pharmacies as well, is dependent on where you live, you may have limited access maybe to pharmacies. Maybe you live in a rural area and there isn't, one of the big box stores there. So it's an independent pharmacy. So another thing to make sure and check is whether or not that pharmacy is in the preferred network as well for your insurance provider, because otherwise you could end up having a bit of a drive trying to get your drugs.
Excellent point. Very excellent point. Because if you're ill and not able to get to that big box a couple of towns over, then your copay is useless, because you're going to have to pay the full price for that prescription.
Yeah, all suddenly starts to get very expensive. So anyway, as always, great information, Judy. We're grateful to have you and that you stay on top of all of this for us. And you look after yourself, and we will speak to you again in the next episode.
Thank you, Brian, and have a great day.
That's all from this edition of Generations. Don't forget to visit seniorcenterct.org to find out what's going on in your neck of the woods. And if you want to send us a topic to talk about or want to be our guest on the podcast, drop us a line by visiting the seniorcenterct.org website. Go to the bottom of the homepage and click the How to Advertise with Us link to get in touch. From myself, Brian Scott Smith, thanks for listening, stay safe, and we'll catch you next time.